Hi there. My name is Jennifer Becker, and I work as Outreach Coordinator for the Finger Lakes Children's Environmental Health Center. Today, I'm sharing tips for protecting children from harmful environmental exposures. And I'm excited to present this now because October is Children's Health Month. Also, the second Thursday in October is always Children's Environmental Health Day. The Finger Lakes Children's Environmental Health Center prevents, diagnoses, and treats environmentally related conditions for families in our 15-county region. We are one of 7 children's environmental health centers in a network across New York State funded by the Department of Health. We call ourselves Flexi, and our region covers the Finger Lakes, plus some of the Southern Tier and Central New York counties. This presentation is based on a New York State Department of Health publication, which you can also find online in English or Spanish. Instead of focusing on all the specific chemicals, the 7 best kid-friendly practices encourages general principles that can help reduce overall exposures. If you would like your own copy of this booklet or get some to share with families you work with, here's the website where you can order up to 200 copies for free. So how do exposures happen? What are the pathways they get into our bodies? Chemicals can get into our bodies through breathing, through eating or drinking, or through our skin. We're focusing on children because they are at greater risk for harm from chemical exposures than adults are. Why is that? Well, kids crawl on floors, play in the dirt, and put their hands in their mouths. Children eat, drink, and breathe more for their size than grown-ups do. Their bodies are still developing and have a whole lifetime ahead of them for exposures to take effect. Also, children have no control over their environment. So let's look at what the adults in their lives can do to protect them. Practice 1 is keep it out. Keep out secondhand smoke. Make sure people smoke outside. Keep out contaminants, which can be tracked in from outside. Make sure to use a doormat and remove shoes at the door. Keep out spray drift from pesticides. If a neighbor is getting pesticide applied, avoid the area where spraying takes place during and then for 30 minutes afterward. Close windows and doors and turn off window-style air conditioning units. Keep out gasoline fumes. Use proper storage containers for gasoline and store it in a shed or garage. Keep out mercury, which can spill from broken thermometers, thermostats, etc. Never use a vacuum cleaner, mop, or broom to clean up a mercury spill because that will not contain the toxic mercury vapors. Keep out smoke from burning trash. Instead, follow the reduce, reuse, recycle principle, and then dispose of remaining trash at a transfer station or with a sanitation service. Practice 2 is related to household products, and we need to choose and use them wisely and reduce them as much as possible. For cleaning products, keep only a few on hand and use sparingly. Look for the EPA's Safer Choice label. For pesticides, prevent pest problems by cleaning your home, yard, and garden, and try using non-chemical methods like weeding, mulching, and setting traps. Don't overuse insect repellents. Avoid DEET products with greater than 35% DEET. Avoid eyes and mouths when applying. Reduce use of air fresheners and candles, as some of these may contain harmful chemicals. For personal care products, think about which products are really necessary. And use smelly art supplies in well-ventilated areas. Practice 3 is air it out. Use paints, wood finishing products, and hobby supplies outdoors or in a well-ventilated area. Do indoor projects during warmer months when windows can be left open for better ventilation. When you buy new carpets, furniture, and bedding, put them in the garage to air out before bringing them into your home, or open the windows, close the doors, and try to stay out of the rooms until odors are reduced. Practice 4 is wet, wipe, and wash. Contaminants such as bacteria and pesticides can be in and on food, so wash fruits and vegetables under running water just before eating, cutting, or cooking. Do not use soap, detergent, or commercial produce washes. Lead dust can be in buildings built before 1978. Wash your hands, your children's hands, and toys with soap and water frequently. Damp mop floors. Wash windowsills, including the area between the sill and the outside window or screen. And if you work with lead for your job, wash your clothes separately. Practice 5 is keep kids away. To keep kids away from household products, put locks on cabinets and store products out of children's reach. Dispose of unused and unwanted products properly. Keep children away from areas where pesticides are sprayed or spot treatments are being used. Remove toys and stuffed animals before you treat the area. Don't let kids touch flea or tick collars or any repellent used on pests. Also, it's very important to read and follow directions on labels. It's especially crucial to not mix bleach with other chemicals, as that can create toxic fumes. Practice 6 is find it and fix it. Radon is a colorless, odorless gas which is radioactive and increases the risk of lung cancer. Test your home for radon every few years and retest after remodeling, weatherizing, or radon mitigation. Carbon monoxide is also a colorless, odorless gas. When people are exposed, the carbon monoxide molecules will displace the oxygen in their bodies and lead to poisoning. Have a trained professional inspect, clean, and tune up your central heating system every year. Never use a generator inside your home, garage, crawl space, shed, or similar areas. Place a carbon monoxide alarm on each level of your home and outside each sleeping area. Molds can trigger allergies or asthma. Prevent mold growth by finding the source of leaks or moisture and repairing them. Use a dehumidifier and make sure to empty the reservoir and clean it frequently. Remember that mold spores can grow on any surface in your home that has sufficient moisture or is wet. If fuel oil is stored indoors, make sure it is delivered properly and there are not any leaks. Clean up any spills completely. If children are around any playground equipment, decks, or furniture made with pressure-treated or chemically treated wood, apply a penetrating protective coating, like an oil or water-based stain, on a regular basis to the structures. Seek out alternative kinds of wood to rebuild decks and furniture if possible. And choose playground equipment and furniture made from metal, recycled plastic, or untreated natural wood. Water can contain chemical and bacterial contaminants. Test your well water at the tap at least once a year for bacteria and every 3 to 5 years for other contaminants. If you have municipal water, you can get a water quality report. Find and fix lead-based paint, which can be in homes built before 1978. Use wet techniques for small jobs involving the removal of lead-based paint, and for larger jobs such as renovation projects, use professional help or learn how to do it yourself safely. The last kid-friendly practice is talk to your provider. Be aware of radiation safety issues for children and talk to your pediatrician about which imaging options are appropriate. Talk to your pediatrician about what makes your child's asthma and allergies worse. Work with them to learn how to avoid or control these triggers. Lastly, if you are pregnant or expecting to become pregnant, ask your physician about environmental exposures that may be a special concern. For example, use of pesticides, insect repellents, eating locally caught fish, exposure to lead, mercury, and other chemicals. And if you have specific questions, please contact us at the Finger Lakes Children's Environmental Health Center. Our Flexi team is directed by pediatrician Dr. Sandy G. Also, I want to give a shout out to medical student Kristen Sportiello, who assembled this slideshow for Flexi. Here are our phone number, email, website, and Facebook page. Please email or call us. Thank you.